Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, Presidency to clarify next phase of lockdown ease as COVID-19 cases in the country nears 6,000. Global health leaders meet to review international response to COVID-19 pandemic. And Cross River State to produce personal protective equipment for students, media houses for free. Nigeria began relaxing its lockdown restrictions after President Muhammadu Buhari, in a speech on April 28, announced that businesses can resume operations from Monday, May 4th in Lagos, Ogun and the Federal Capital Territory to manage the economic fallout of the COVID-19 pandemic. He, however, put an immediate lockdown in Kano State, experiencing a rapid rise in the number of COVID-19 cases. Now, following the two-week period, a decision is expected as to whether to tighten the lockdown protocol or remain at the current phase or perhaps move on to the next phase. But this progression to the subsequent phase will be subject to evaluation by the state and federal government, along with guidance from the Nigeria Center for Disease Control. Only yesterday, the president received a briefing from the Presidential Task Force on COVID-19 at the State House, evaluating data and active cases and the progression across states. On our theme this afternoon, we find out if the federal government will maintain, reverse or further ease the lockdown in Lagos, Abuja and Ogun states, and how subnational economies can gradually begin to reopen. The Nigeria Center for Disease Control, NCDC, announced 338 new cases of COVID-19 in 17 states and the Federal Capital Territory, one of the highest infections in a single day. As at this moment, the total number of confirmed COVID-19 cases in the country is 5,959, with 1,594 patients discharged and 182 deaths recorded. In Lagos, there are 177 new cases, 64 in Kano, 21 in the FCT, 16 in Rivers, 14 in Plateau, 11 in Oyo, 9 in Katsina, 4 each in Jigawa and Kaduna states, 3 each in Abia, Bauchi and Borno states, 2 each in Gombe, Akwa Ibom and Delta, and 1 each in Ondo, Kebbi and Sokoto states. A breakdown of the figures by region shows that Lagos in the southwest still has the highest number of cases, with 2,550, followed by Kano in the northwest with 825. While in the north-central region, the Federal Capital Territory has the third highest tally in the country with 418 cases. Bauchi and Borno states have the highest cases northeast with 215 each. Edo leads in the south-south with 95 cases, and Enugu in the southeast with 12 confirmed cases. The National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Eliu, has been speaking on the efforts of the task force, who have been reviewing and monitoring closely compliance levels and ways to stemming the spread of COVID-19 across the country. Mr. Eliu stresses that there are some concerns in terms of implementation, but however insists that recommendations have been made to the President, and everyone will have to wait for his decision and review of the past 2 weeks of the first phase of the ease of lockdown today. He was a guest on our political program, Sunday Politics.
At this point in time, we don't even know whether we'll go into the second phase or we might revert. So, as I said, we already know the places that we have allowed to start operating, and we've reviewed the guidelines that we have, and we've made our recommendations. So, at this point in time, I think it's premature to say whether places of worship or schools will open, etc., because who knows, maybe the places that are currently open may also close. So we have to wait until we get the decision of Mr. President, and then we'll go into further detail, just like we did with the last lockdown, where we provided additional information immediately after Mr. President's address. We will do the same thing as well with this coming phase. Nothing stops a phase 1 from being changed. Nothing stops us from progressing to a phase 2. But it all depends, as I said, on Mr. President's decision tomorrow.
And as Lagos begins the second phase of the gradual easing of the lockdown, the state governor, Babajide Sanwo-Olu, has issued new guidelines that would hasten and guarantee safety of residents and contain the spread of COVID-19. Governor Sanwo-Olu says a register will be open to ensure inspection of businesses, compliance with physical distancing rules before the lockdown can be lifted totally.
We have not seen an 80 or 90% compliance yet. I must also express that we're not very happy with the yellow buses at the level of compliance. Their union have assured us that they will continue to work on their members. And we've seen that commitment from them, but it's still a question of the followership. And we'll continue to work and encourage them that they impress on their followership. We'll be starting what we call register to open, meaning that all of the players in the restaurant business, spa business, event centers, entertainment, the malls and the cinemas will go through a form of re-registration and space management. We will be coming to their facility. There will be a regulation that will be coming out, but we'll be supervising and we're coming to their facility to see their level of readiness for a future opening. Similarly, also at our places of worship, as much as possible, we will be going and working with them to see their level of preparedness in the event that we're going to unlock them in future. How well have they spaced out their auditorium, their places of worship? How many people can it take at any point in time, ensuring that we keep as much space as possible before we begin to see them being ready for that unlocking.
Talking more about ways we can stop the spread of COVID-19. Joining us via Skype from Abuja is Dr. Adam Mohaved, former Executive Director, National Primary Healthcare Development Agency, currently the Global Program Director, D8 Countries Health and Social Protection Program. Thank you so much for joining us at this time. First, tell us, how would you say we are handling this pandemic in Nigeria?
Yes, thank you very much. Let me also use this opportunity to say good afternoon, Nigerians. I think so far, the pandemic response in Nigeria, one can say we are on course. I'm saying we're on course because I'm sure people are complaining that the numbers are rising. I mean, it's expected, you know, there is a limit, there is a time in which it's expected that the case count will peak and then it will now start reducing. But so far, the responses of the Presidential Task Force on COVID-19, the coordination of NCDC and the Ministry of Health, I think they are doing very well. What we need to do further is to see how we can contain community transmission, because we are now at the phase of community transmission, in which we expect the numbers to multiply. So we need to see how we can contain the reproductive rate of the virus. And so what do I mean by that? I think the effort now should be focused at the community level, because that is where the problem is. Because if we really do not contain it at that level, then we are likely going to see exponential increment in the number of cases. And when that happens, then the burden also will be on our health facilities and also the community. So it's important that we provide some support to states and local governments. So I believe that the primary care healthcare infrastructure is now time to deploy the primary healthcare infrastructure to support local government and states to ensure that we contain the virus at that level, because the fight now is in the front line. And if you're talking of tackling frontline issues, then it's at the primary care level. You know, so, and luckily for us as a country, we do have a track record and history of containing epidemic, you know, and outbreaks. We've done it with Ebola. We've done it with Lassa fever. We successfully also did it with polio. And these infrastructures are all available, particularly when you come to the community level. The polio infrastructure is available. And it was what we used in 2014 to also contain Ebola. So we need to deploy that infrastructure, which is available in every political world in this country. We've established a community interface with primary care. In every community in this country, we also have DSNO officers that could easily track and trace cases. In every local government in this country, we also have a network of community mobilizers, because at this particular point in time, we need to aggressively sensitize the public. We need to tell them that COVID-19 is real. We need to tell them that to prevent COVID-19, we have to be alert. And in being alert, we need to ensure that we comply with the guideline as advised by the Nigerian Center for Disease Control in terms of social distancing.
Dr. Mohaved,
remaining at home as much as possible. And also,
if I might quickly jump in, I just wanted to get your point of view. The Lagos governor has said that a register will be open, and this is for inspection of businesses, compliance with all of the safety protocols. How do you think that, the state government would do this and ensure that these measures are adhered to? And do you expect other state governments doing the same thing in the wake of relaxation of lockdown?
Yeah, I think I didn't get you right, but if I get, can you say that again?
Yeah, so I was asking that the Lagos State governor is saying a register will be opened to ensure inspection of businesses, event centers are complying with all of the safety protocols. How do you expect that the government will do that and ensure that all of these measures are adhered to within this period? That's one of the conditions for lifting of the lockdown totally in Lagos State. And if you expect to anticipate that other state governments will do the same.
I think what is most important is for us to dialogue with individuals, the communities. We need to make the communities aware of the fact that first, COVID-19 is real. Secondly, we also need to make each and every individual know that while the government has its own responsibility in terms of discharging its own obligation as relates to the COVID-19 national response, equally, we as citizens also have our own responsibility. And what is that responsibility as citizens? What are those responsibilities as citizens? First, we need to protect ourselves. We need to protect our family. We need to protect our community. And how do you do that? Is complying with those personal hygiene that have been dictated and advised by health professionals. And also by ensuring that we, as soon as we are leaving our homes, if it becomes necessary, we have to leave our homes, we have to make sure that we have masks. That will protect us and also protect others. And we also need to keep safe distance, so that in the event that you are coming into contact with an infected case, or if you are an asymptomatic carrier, and because we've not done enough testing in terms of knowing who and who has the virus. So if you're an asymptomatic carrier, you don't also infect another person. So the communities, individuals need to know that, yes, the federal government, state government, local government have their own obligation to the citizens. But the same way, citizens also have their responsibility they need to discharge for themselves, their families, and then the community. And I'm sure if we look at it both ways, then it's likely that we'll be able to contain the community transmission. And just as we did for Ebola, and then we did for polio, Nigeria will be commended. But so far, we are doing well. We just need to ensure that aggressively we proactively attack.
Loads of optimism there. We'd like to thank you, Dr. Adam Mohaved, former Executive Director, National Primary Healthcare Development Agency. Thank you for joining us on the program.
You're welcome. Thank you.
Still to come on our COVID-19 update, the coronavirus pandemic takes center stage as envoys from 194 of the World Health Organization's member states meet virtually for the 73rd Assembly of the United Nations body. We have that story and more when we return. Welcome back. The Cross River State Executive Council has approved the sum of $2 million for the direct procurement and airlifting of items from China for the production of personal protection equipment by the garment factory. Briefing newsmen at the end of the meeting, the Commissioner for Information and Orientation, Mr. Asu Okang, said after deliberations on the memo presented, Council considered it critical for the continuous protection of the citizens against the ravaging coronavirus. He said the materials will be distributed to children free of charge, both primary and secondary schools of the state when school finally reopens, and media houses across the country free of charge.
Approval for $2 million, that is about 1 billion equivalent for the importation of materials. This time around, not just for the production of face mask, but you also have the nose mask, but you also have the face mask. The face mask that will be produced, that's like a shield, the shield mask, that is meant to ensure that once it is produced at the garment factory, the mask should be distributed, or face shield should be distributed free of charge to students or pupils in primary and secondary school, pupils in primary school and students in the secondary school, so that to enable our children go back to school in the next few months.
Well, we have guests joining us right now in Lagos. We have Dr. Raji Cordray. He's a public health physician. Welcome to the program.
Thank you for having me.
And joining us from Abuja studios is Professor Titus Ibekwe. He's an ENT surgeon, also a public health physician. Welcome to the COVID-19 update.
It's a pleasure to be here. Thank you.
Let's begin with you, Professor Ibekwe, and that is your point of view as we witness, or we hope to see, a review in the lockdown ease from the federal government today. What do you anticipate might be the decisions or the measures that will be taken from today?
Yeah, you know, this type of decision is something that should be evidence-based. It shouldn't be anecdotal in any way. And that is purely the responsibility of NCDC and the task force teams, and indeed the specialist group that they have put together, who have been monitoring the progress and situations of things in the country. But we are all also key players in this development. It is very obvious that with the very first week of relaxing the lockdown was, I would say, catastrophic. We realized that a lot of people were out there in the street. Unfortunately, the various organizations that were supposed to make sure that those rules and basic rules and regulations were obeyed did not actually stick to the rules of the game. The banks, for instance, within that first week, most of the branches were locked up, and this led to a lot of crowding within the areas of the few branches that were open. And you see people pushing and pulling and definitely breaking those rules and regulations. And a lot of damages could have been done even with that singular action. It didn't stop at that. Even modes of transportation, we thought that the National Union of the Road Transport Workers, that they have already finalized, an agreement, have written an agreement with the task force team on how to be able to handle the situation. But unfortunately, we still witnessed a lot of crowding within the vehicles, some carrying up to 4 people in a taxi. And
do you expect that there will be a status quo would remain, or that there should be a total lockdown, or things should go on as they are?
Yeah, really, the second week, because I was just building up, the second week actually was a lot better than what we witnessed within the first week. And the reality is that lockdown is not an end on its own, is a means to an end. So what is very important at this point in time is ensuring that our testing capacity is increased even more than what it is now. Some improvements have been made, and that we have to deploy other measures, that will assist even the PCR method that is being used now, since NCDC have discovered that the gene experts and even the machines earlier on used for, the testing for HIV in the country could be
One moment,
reconfigured.
Professor. Let's quickly bring in our Lagos guest. One moment, Professor, with all due respect. Dr. Cordray,
yes.
Taking from, where he has stopped, looking at what Lagos is doing and the guidelines, are you optimistic at some of the measures to containing COVID-19?
Well, to start with, the Lagos State government has expanded the testing capacity, and that has yielded results with increased positive results that we see every day. That's one step in a positive direction. The easing down of this lockdown, how has it impacted on the results? How compliant are our people? On my way down to this place, you can see how crowded our bus stops are. The buses are crowded to the brim. I'm scared in the next 2-3 weeks, if we really test to the capacity, what the outcome is going to be. Sincerely, I must be sincere with you, the disregard to professional advice that we've been given, people are not complying. People are not wearing face masks. You see people holding hands. You see banking compound being crowded. You see bus stops being crowded.
So what would you say we need to do now?
Number one, let's maintain the tempo of the testing capacity. Number two, continue social orientation. This public enlightenment must continue. The social media influencers must up their games. Then let's continue to tell our people being tested positive is not an end of the world. I work in a sampling collection center. People come around to give us fake address, fake phone numbers, that when they eventually come out positive and you're trying to trace them, they are nowhere to be found.
All right, finally to you, Professor Ibekwe, if I may, what do you see happening in the next few days, or what would you want to happen following ways to contain the virus spread?
Yeah, what is very important here is the testing capacity has to be increased, expanded, and the reconfiguring going on with these machines to ensure that this is realized has to be expedited by NCDC. And again, public enlightenment program, has to be scaled up. And not just on television and radio, it has to be taken down to permeate into the fabrics, of our hinterlands in languages and the way that they will understand, so that people will know that this is really, really real. I think a lot of enlightenment program in the education is still needed because a lot of people are still in denial as we are speaking. Even people who should know better, some educated people are still in denial. So that means we need to do a lot of work. If we have to, reinvent full lockdown, I tell you that that's not the solution, except if the other aspect, the other wings that will help this to succeed are really, really put in place, i.e. testing, and secondly, enlightenment, and thirdly, people need succor that will help them into complying to any of these rules and regulations that are
We appreciate your time. When we look at all the things that have happened, the first week after the ease of lockdown and the number of cases that we had, and then looking at the second week after the lockdown relaxation, I guess it would give the federal government and states a lot more to think about as they try to safeguard Nigerians. We'd like to thank you, and we know you will be joining us a little later for more on ways that we can curb this spread. Professor Titus Ibekwe, ENT surgeon, thank you so much for joining us from Abuja studio, and also Dr. Raji Cordray, a pleasure having you on the program.
Thank you for having me.
For the next 2 days, global health leaders are set to push for an independent review of the response to the COVID-19 pandemic at the UN's World Health Assembly. The WHO will face questions on how it dealt with the coronavirus pandemic, which has also killed over 300,000 people, infected more than 4.7 million globally. Take responsibility in protecting your health. The NCDC says the virus that causes COVID-19 can spread by touching a contaminated surface. So take care. The website has all the information and statistics. Also the same with the World Health Organization. It says physical distancing is one of the most effective methods to limit the spread of COVID-19. Also, our website, channelstv.com, has all the information you need. You can take a look at some of the stories from our website, www.channelstv.com. Another update comes your way again at 6 p.m. I'm Minister Ntuwonka. Stay healthy, stay safe.